The consequences of Western medicine's wrong treatment for diabetes make patients blind. We must ask ourselves the question, when blood sugar is 10 mmol high without treatment, eyes are not blind. After abstaining from sugar, injecting insulin for a long time, he or she went blind. So, is blindness before treatment or after insulin injection to cure disease? Ladies and gentlemen, I would like to share with you some things that you still don't know and may be misunderstood about diabetes. My mother-in-law is 59 years old this year. She has been diagnosed with diabetes by Western medicine for nearly 20 years now. When her blood sugar reading was 7.0 mmol. It was just that she felt tired for a few days and then went to the hospital. Since then, she has always adhered to the treatment regimen of Western medicine, taking diabetes medications regularly, limiting starch intake and almost no sugar. But that didn't bring her any better health than it did before she didn't take her diabetes medication. Along with that, her blood pressure increased. Systolic reached 145 millimeters of mercury at the age of 54 and had to take antihypertensive drugs again. During the course of taking diabetes medication, her blood sugar often fluctuated from 9 to 15 mmol, sometimes to 20 mmol. Then her eyes began to fade. 2 years ago, she had knee effusion, had both knee aspirated and then walked better. But after only about 5 months she was in great pain and had difficulty walking. She had to use Western medicine to inject directly into the knee joint, which is also a pain reliever. Everything is still not okay. Before and after the last New Year 2023, her blood sugar continuously increased, usually up to 25 mmol. She began to feel tired, dizzy, nauseated and vomiting. She was hospitalized for diabetes treatment. At the hospital, they injected insulin but no longer used sugar-lowering drugs, 4 injections a day. The first week of injection, the blood sugar index did not decrease. Then on the 15th day the blood sugar dropped below 10 mmol, and she was further convicted of adrenal insufficiency. Very weak internal organs. At this time, it was the 29th Lunar New Year 2022. The hospital let her go home for the new year to bring blood sugar lowering medicine and insulin home for self-injection. After staying at home to celebrate Tet for 15 days, she rode a motorbike to the hospital to have her diabetes checked again, because it was not yet morning and her eyes were blurry, so unfortunately a traffic accident broke her right foot. After going to the emergency room, they continued to ask her to stay in the hospital to treat diabetes because the sugar was up to nearly 20 mmol. Diabetes will make the wound heal slowly. Nearly 20 days in the hospital, they received 4 injections a day. Then discharged when the blood sugar dropped below 9 mmol, and the adrenal insufficiency was worse than the previous visit. After 2 courses of treatment, while taking sugar-lowering drugs and injecting about 132 insulin shots, she became very weak. Her eyes could no longer see clearly at a distance of 5 meters. On March 22, 2023, I took her to the Central Eye Hospital. They examined her and told her that if she didn't operate soon within 1 month, she would be permanently blind because of her severe condition and could not replace the lens but could not operate immediately due to high blood sugar. After a few days, she operated on her right eye and continued to operate on her left eye after the next 15 days. Do you have any thoughts and questions when reading the story I told above? Why did my mother-in-law take diabetes medicine for nearly 20 years but the sugar did not decrease and vice versa increased more than before? 1. Why is it that when she takes a sugar-lowering drug, she becomes weaker and weaker with other diseases? 2. Why do you take more sugar-lowering drugs, the more insulin you inject? The higher your blood sugar, where is the sugar? 3. Why did you abstain from starch and sugar but blood sugar did not decrease? Lots of questions arise, and I will answer for you. It is insulin and glucose-lowering drugs that take away the glucose in the body from fat, from muscles, from nerves, from bones. Needed to feed cells and create energy for the body to function while the body is still must work without the body being supplied with sugar by eating starch, drinking sugar. Where can the body get the sugar to work, for the heart to contract, for the brain to think and for the muscles to work? That sugar is the sugar in the muscles, in the cells, in the bones that was previously accumulated by the body, and now has to be taken out into the blood for the heart to contract. Thus, the sugar is still high, the more insulin is injected. The higher it is due to the loss of sugar for the heart to contract and then the body atrophy, loss of strength, fatigue due to sugar loss. This is not known by Western medicine. I wonder why Western medicine doesn't have a blood sugar booster, or advise the patient to drink a cup of sugar? Low sugar causes stroke because the heart does not have enough blood to pump blood to the brain. My mother-in-law has many other diseases that are caused by the loss of sugar in the body. This is the key cause. The loss of sugar has made all the functions of the internal organs and muscles weakened, leading to atrophy and cirrhosis of the liver. Kidney dialysis because the kidneys lack sugar to contract, heart failure due to the heart. Insufficient blood sugar causes anemia. So have you asked yourself? Diabetes causes complications such as blindness, heart failure, kidney failure, amputation of legs and arms due to eating a lot of sugar or not eating sugar. But because insulin injection destroys all the sugar of the cells in the body, causing complication. Diabetes? True or false? After 2 years of knowing the Qigong Wai Dao of Master Du Duc Ngoc, that gave me so much knowledge that I didn't know before, I have enough knowledge to explain why it is so complicated after diabetes. So heavy and terrible. Actually, the simple answer is, due to taking sugar-lowering drugs, losing sugar is a loss of energy for internal organs to function, weakening and causing most diseases as well as not giving you food. Do you have the strength to work? So complications of diabetes are caused by the body losing sugar. Sugar is energy. If you follow and learn the Qigong Wai Dao of Master Du Duc Ngoc, you will understand what diabetes is and is it scary or is it necessary and indispensable. No one in this world has diabetes and has to take medicine for the rest of their life. Hope everyone is wise not to let a situation like my mother-in-law happen. Fu Kai Chin.